Good afternoon, and thank you all for being with us today. I do want to quickly update on the storm threats that we have been tracking over the past several days. In many ways, our prayers have been answered because the first storm, Marco, has mostly dissipated and poses little to no threat to our state at this time. We also are monitoring Laura very, very closely, which currently is listed as a Category 1 hurricane. We are not projected to be in the middle of the cone at this moment, but obviously Laura has just come into the Gulf of Mexico within the last 12 hours. Things can change, and so we want to continue to monitor that very, very closely. But we are going to continue to pray for the best, prepare for the worst, and expect somewhere in between. But even if we do not take a direct hit from Laura, from this hurricane, we do know that we have several risk measures that we need to be aware of. Certainly, tornadoes are a risk, particularly in West Mississippi. We also will see high winds, and Laura is currently projected to come ashore somewhere around the Louisiana-Texas border, but it's also scheduled to take a fairly sharp right turn once coming ashore and moving to the east very quickly. And so we could see significant amounts of rainfall in the northernmost area of our state, particularly in that northwest quadrant that we have been talking about. We also know that we're still probably 36 hours out before landfall at least, and so we'll continue to monitor that in the days and hours ahead. Again, it's currently a Cat 1 hurricane and could get up to a Cat 3 hurricane. We're also continuing to battle COVID-19. Things have been improving, but the threat is still very much present. We've seen a leveling off of our previous decline. That could be a sign of a rebound of total number of cases, and we are tracking that very, very closely. Obviously, the last 2 days, Sunday and Monday, we had significantly higher total numbers than we did Sunday, Monday of last week. And today's numbers, which we would have hoped would have declined relative to last Tuesday, was actually almost exactly flat. I believe we had 796 cases last Tuesday and 801 today. And so we're monitoring that closely. Tomorrow will be another big day, but we've got to continue to stay in the fight. We do not want to go back to the high numbers that we were seeing just 2 and 3, 4 weeks ago. We need everyone to continue to try. We need everyone to continue to make an effort. It is as important today as it has ever been. You can keep our kids in school. You can keep sports being played on the field. We can keep businesses open, and we can save lives if we will just do the little things right now. This fight is not over. No trend is inevitable. It rests completely on our joint efforts. But as I have told you repeatedly throughout this, on the good days, I'll tell you the good news. On the bad days, I'll tell you the bad news. We have had a slight uptick in cases, but as the lagging indicators of hospitalizations, of total ICU patients, and of those on ventilators have continued to decline very rapidly over the last 10 days or so. It shows what can happen if we'll all buy in to do the little things that make a difference. And so I'm actually going to change things up just a bit today and turn it over to Director Michelle first so he can talk about hurricane, and then we'll come back to Dr. Dobbs after that. Director?
Yes, sir, Governor, thank you. Really, Governor, pretty much nailed it on the update as far as what's going on. Just a few things that I would like to reiterate to what is it going to mean for Mississippi. As the Governor did mention, we've seems like we're obviously going to miss the brunt of these storms. But I want to remind everyone that there will be second and third order effects with regard to rainfall. with wind gusts and potential spin-up tornadoes pretty much across the entire state. But the bands of rain, where was previously mentioned, primarily your concentrations of rain in southwest Mississippi, and then as this storm makes its turn off to the east, coming out of Arkansas, you will see potential for a lot of rainfall up in north parts of Mississippi. So just be aware of that. Storm surge watch, generally speaking, 1 to 3 foot generally around Harrison County, and then need to be watching for more of a surge in Hancock County and upwards of 5 feet. We just have to watch that pretty much. So far, for a 5-day forecast, no other tropical waves out there right now. So we've got a little bit of reprieve behind these storms, and just battle the rain through the end of the week, and we'll keep our eyes out as the season progresses. Governor, that's all I really have today.
Thank you, Director Michelle. At this time, I'll turn it over to Dr. Dobbs to give us an update on our numbers.
Yeah, very good. Thank you, Governor. Today, we're reporting 801 additional cases of coronavirus, bringing our total up to 79,206. Sadly, 67 additional deaths are being reported today. A large number of those were gleaned from vital records and validated, so 23 of those were from death certificates, bringing our death toll up to 2,315. We did have a very successful event with the Mississippi Band of Choctaw Indians last week. Like to really give a shout out to Chief Ben and his crew. They did a remarkable job working with us. We tested a total of 926, both people in the local area and also within the Mississippi Band. We had, of that 926, 36 were tested positive, none of whom had symptoms at the time of testing. We had 709 who performed serology with 78 positives, or 11% positivity rate. If we look at those who were members of the Mississippi Band of Choctaw Indians, we tested 338 for PCR, or active infection, with 14 positives. Of the serology, 252 had serological results obtained, 48 positive with a 19% positivity rate, which really reflects the high infection rate and the large number of infections that have been afflicting the Mississippi Band for a while. So not entirely surprising, but certainly the highest rate we've seen so far for serology. If we look at our hospitalizations, we do continue to see trends in decreasing hospitalizations, down to 730 hospitalized patients with COVID, 232 ICU, and 119 ventilator patients. Certainly all good trends, but we want to keep them that way, and worried about our future, obviously. Want to make sure we keep up the gains that we've obtained. If we look at our school numbers, we will, and I'm assured it'll be on our website today for y'all who are interested, by county. We'll report new teacher cases of the week of July 17th through 21st, 144 new teacher cases reported, 292 new students, 31 outbreaks for last week, total teachers quarantined 584, and a total number of students quarantined 3,913. One thing I would like to say that I've never said that I would like to just reiterate, for everyone out there, if you lose your sense of taste or smell, you have coronavirus. It's a relatively unique thing. We have a lot of people that we've interviewed, and they'll say, yeah, I noticed I lost my smell and taste, and then would keep on doing things for a few days when they were contagious. So just as a heads up, if you lose your sense of taste or smell, you almost certainly have coronavirus. So please call your doctor, your clinic, isolate yourself, and please be well. I would like to mention also that we have had the report of reinfection from the traveler to Spain. A remarkable sort of event. It certainly tells us a lot about what happens with the infection, so it is plausible. The individual was sick with symptoms on the first go-round and asymptomatic the second time, which may represent the immune system adequately controlling the infection. We will let you know as we learn more and keep everyone up to date. But certainly something we're watching with great interest, the reinfection question. And the last thing is we are continuing to do our teacher testing. Today we are in Tunica, Holmes, Choctaw, Yazoo, Clark, Lauderdale, Emmett, and Pontotoc. And tomorrow, if you're a teacher, staff member, administrator, and you want to get tested, just show up between the hours of noon and 7, and we'd love to test you. Tomorrow will be Grenada, Lafayette, Sunflower, Noxubee, Rankin, Wilkinson, Greene, and Hancock. And that's all I have, Governor. Thank you.
Thank you, Dr. Dobbs. And I just want to reiterate to those teachers out there that would like to have peace of mind, you do not have to have symptoms to get tested at one of those 7 locations that Dr. Dobbs just mentioned. Rankin County, I heard him say tomorrow. Hancock County, I heard him say tomorrow. Lafayette County, I heard him say tomorrow. There's several others. And so we'll be sure and put those out via social media on our networks later today, so as to remind everyone, we want you to take a test if that's what will help you feel more comfortable. We want to give you that option, and we want you to take advantage of that option. It's the reason that they're opening from noon until 7, so as to give you the ability to drive through. They're not going to be long wait times. It's simply going to be a way in which to get tested. I was speaking to a friend of mine not long ago that was saying that it is kind of hard to just get a random test. Well, if you're a teacher in Mississippi, that is no longer hard. We're going to come to you and give you that opportunity. So these numbers that we're seeing in our schools are not unexpected. As I have said repeatedly, I am pleased the number of isolations that we're seeing, the quarantines that we're seeing, and I'm pleased that there are a large number of Mississippi kids that are sitting in a classroom right now learning in a safe environment. And so we got to continue to monitor it. We got to continue to be careful, and that's something that I'm certainly committed to doing. So with that, I'm going to open the floor to questions. Yes, sir.
Yes, for Director Michelle, as far as on the coast, has there been any storm damage down there? Have you heard any reports of flooding or anything in the areas?
We had some low-level flooding in Hancock County with Marco a little bit, and that's not uncommon. And more than likely, they're going to get the brunt of any storm surges that we'll see there. It'll also transcend up to Harrison County, but nothing major at this point. We've been very fortunate up until now.
And just to follow up on that, do you anticipate any of those? You said there hasn't been much already, but do you anticipate that sticking around for when Laura rolls in and possibly compounding to make things worse?
Well, we had a little bit, we didn't have the effects with Marcos that we'd anticipated. That developed into a hurricane, and then before it made landfall down to a tropical storm. So we didn't get that kind of that vacuum effect with holding that water in like we'd anticipated. The biggest concerns that we have right now is going to be when that storm makes landfall, and it is anticipated, as the governor's already mentioned, to be a Cat 3. When it comes on land and makes that turn to the east, what is it going to bring with it? We already know, wind and rain. So we'll have some localized area flooding, particularly down in Hancock County, where they always have a lot of that. It's just something we got to watch. I'm not concerned about it. The EMA directors are postured to deal with it, so we just got to watch it on a daily basis. We got about 3 more days. We're going to really stay vigilant.
Thank you, Governor. Dr. Dobbs, I get that you mentioned that some of those 23 of today's deaths were from the last month and a half in terms of death certificates. But can you talk about the reason for the sharp spike? I mean, if you look back over the last couple of weeks, it's certainly significant. And also, this number comes 3.5 weeks after the most single-day cases the state had seen. Is this indicative of what we might expect to see going forward? Because, we had a significant number of cases back some 3.5, 4 weeks ago.
Yeah, no, a great question. Certainly, deaths do lag cases, and we still have a lot of cases. So we're going to continue to see deaths. So please, don't let your guard down. We all have a really strong role to play. As we follow the trends, it's important to watch the date of death, right? That's going to be on our website. Kind of like the same thing with the date of onset of illness, because it's going to be a better indicator. A lot of those, they take a long time to evaluate, because whenever we do a death certificate evaluation, we do pull the chart, we verify that they actually tested positive, because we do exclude a lot of those. We don't want to, include things that are not really COVID related. But yeah, we'll just have to follow the trends and see where it goes, because we're going to see a lot more deaths because we have a lot of cases, and it's going to trail. So we have, 800 new cases today, and we know our mortality rate's going to be over 2%. So out of that, you got to imagine there's going to be 16, 20 deaths that are going to be reported. So in the next few weeks, probably related to those numbers.
Thank you, Renee. I have a question for the governor, and then, if I may, one for Dr. Dobbs. Governor Reeves, that DMR budget finally settled, but lingering problems over, of course, control of the GOMESA funds. When the proceeds grew from hundreds of thousands to tens of millions a year, that kind of got lawmakers' attention. They seem dug in on eventually taking control of the money and the projects. How committed are you to fighting for your continuing authority over those funds?
Well, thanks, Dave, for the question. What I would tell you is we had a good outcome today. Obviously, we felt that we had statutory authority to run the agency in July and August. Once we moved beyond August, it was particularly complicated for us to legally continue to fund it without a budget. And so I met with a large number of legislative leaders from the Mississippi Gulf Coast over the last couple of weeks, and I think the compromise that was found was one that was good for everyone. We're going to continue to fund the projects that were decided upon by the previous governor. We're going to have adequate spending authority to continue to invest in those projects that make sense for the Mississippi Gulf Coast, and we're going to continue to work with those legislative leaders from the coast who I think certainly share my goal, which is to make sure that we properly vet every single project to make sure that we get the maximum benefit from each of the pots of money that exist out there to grow the coast economy. Because as I said repeatedly in 2019, if we are successful at growing the coast economy, that's going to help us grow Mississippi's economy, and that's really what I want to focus on as governor. And eventually, we're going to get out of 2020, and we're not going to be focused on all of the crisis, hopefully, that we're dealing with now. So, you have a follow up for Dr. Dobbs?
I do. Thank you so much, Governor. Dr. Dobbs, Biloxi High School empty right now, 100% virtual classes. All extracurricular activities put on hold until Labor Day, and that would include the first football game of the season on September 4th with the Biloxi Indians. Looking at the trends, do you expect to see more decisions like this being made down the road? I know it's an uncertainty, but what are your thoughts and feelings on that?
A couple of thoughts. It's going to happen. We have cases out there, and if we tend to have a tight concentration of cases and outbreaks, there's going to be times when that's the right decision. And certainly, we've been in conversations with their leadership and the superintendent. There are a lot of complexities to this situation, so we support that they made the exactly right decision. So it is going to happen from time to time. One of the things I think it's really important to say is that this was entirely unnecessary. There were social events that happened in and around the high school that led to these outbreaks that were unnecessary. So if we want to have football, if we want to have school, we can't have social events, even social events that violate the executive orders that are on the books. So please be careful. Don't have parties. Don't have, and if you're a parent, for goodness sake, please don't sanction them or conduct them yourselves, because you're not only putting your kids at risk, but you're also putting the entire educational system at risk.
If I might, Dr. Dobbs and I had long conversations about this situation yesterday, and I appreciated the opportunity to learn about the situation. And I think this is a real opportunity for the people of Mississippi to look at what transpired at Biloxi High School and take the necessary precautions and make the necessary decisions in the fall of 2020 that need to be made to allow us to minimize the number of these things that are going to happen. So let's first of all say at Biloxi, and I commend their leadership for making the decision that they made, but I want to make sure that everyone understands that, first of all, their kindergarten through middle school is still open. And so the bulk of the problems and challenges that we see there are in the high school. These are kids that, as Dr. Dobbs said, in many instances went to social gatherings, and a couple of instances went to very large social gatherings. Because of that, when there was an outbreak and a number of cases that were found that were definitely positive, as the contact tracing started, what it was found is that there were literally somewhere between 1/5 to 1/3 of the entire high school that were going to have to be quarantined, because many of them we're at one large social gathering. These large social gatherings where there are 4 or 5 people that are found to be positive, even though they may not have known that they had the virus and they may have been asymptomatic, is going to lead to a scenario in which potentially you've got 25 to 33% of the entire school mandated to be under quarantine because they came into close contact with these positive cases. Well, at some point, that's such a large number that they decide to more or less quarantine the entire school for 14 days. And so I think it certainly is relatively unique in that there were specific outbreaks within specific groups, and then those specific groups, many of them ended up at a social gathering that was very, very large, in which social distancing was likely not maintained. And so again, I don't think that, certainly I'm not surprised that there is a school in Mississippi that is shut down for 2 weeks for quarantine and going in completely virtual. But I also just think this is a learning opportunity and a learning experience for schools in other parts of the state. Don't have parties with 150 to 200 people there. That's not going to work out well, likely, for everyone else. And so, again, it's a challenge. We know it's a challenge, but I think everyone is trying to make the best decisions possible given the information that we have at this time.
Hunter dropped into it because he looked at his question.
Thank you, Renee. Thank you, Governor. This question is for Dr. Dobbs. This last week, we saw the Federal Health Agency, HHS, start to begin treatment, I believe, for coronavirus with plasma. Do you mind to discuss a little bit about that and where we're going at with the health department if we do make that transition?
Yes. So plasma basically is the it's blood products from people who've had coronavirus before and therefore anticipated would have antibodies in it that could be protective potentially. It's something that's been available anyway under sort of like an investigational protocol, so it can be requested. It could before, but now it looks like there'll be wider availability, similar to remdesivir, which had similar categorization. So that's going to be something that's really up to the managing medical team and to the hospitals to try to access it. Certainly, there are some potential modest benefits that are seen. There's been a lot of conversation in the medical literature that maybe, that the benefits might be modest, but the treatment is considered generally safe. So, there's not a lot of downsides to it other than the expense and the time that it takes to do it, which is something to be considered because, when you're taking care of stuff, folks, you want to do the things you do right. You don't want to be distracted. But that is something that should be available, just kind of like remdesivir is now, where hospitals can order it and give it to their patients if it's needed.
Yes, sir.
Governor, this is another one for Dr. Dobbs. Dr. Byers said, I guess on Friday, that only 450 of more than 1,100 schools actually reported COVID-19 numbers to you guys. Of course, that was last week. How many reported numbers this week in terms of how many are participating? And can you talk about the penalties involved with not reporting?
Yeah, so 720 schools are reporting, and so we're continuing to onboard them as a process because we knew it was, a new sort of thing. So they've been doing great, representing 74 different counties. But this is only the ones who are in school, right? So anybody who's virtual who hadn't opened up yet is not going to be reporting. So that's an important consideration. As far as penalties, we do have a health officer's order, a public health order that mandates reporting, and so there are, sort of penalties in there. We do have every confidence that people are going to work with us on this. This is fantastic information for them to have, and then have been really happy to see, by and large, that they've been pretty transparent with sharing with their public and their parents, because this is just going to be our reality, and we just need to, be honest about what we're seeing so that we can respond to it appropriately.
So CJ, that's approximately 3/4 of all schools are reporting. We have a little over 1,000 campuses statewide, so 720 is just under 3/4. And when you consider the fact that, say, Jackson Public Schools, for instance, and Madison Public Schools, two of our larger school districts are still either virtual only or just have delayed reopening. I think what you'll see is of the schools that are actually open for in-class learning, my guess is that's 90+% are reporting, and maybe even much higher than that. So that's actually a pretty good number, I think, given where we are.
Yes, Governor, and also for you, Director Michelle. I was hoping to talk with y'all about the Hurricane Katrina. We're coming up on the 15th year anniversary of that. What has changed since we've seen Katrina here in Mississippi? What's, as far as reactions go, as preparations, and even like after storms, how we prepare to react to those?
Great question. Yes, I'm sure everyone certainly that's watching on WLOX right now is aware of this, but Saturday is the 15th anniversary of Hurricane Katrina hitting the Mississippi Gulf Coast. I'm looking forward to being on the coast on Saturday, Lord willing, and the weather participating correctly. But there's a lot that's changed. If you go out to the Haley Reeves Barber Emergency Operations Center, as I did twice in the last 3 or 4 days, our facilities have changed considerably. The number of people that are working in those EOCs has increased drastically since that time, 4 days before Katrina hit landfall. And quite frankly, we're just a lot better at it now because we have so much more experience. And Greg and his team are incredible, and the folks that were working during Katrina did a fantastic job. But it just seems like the hurricanes have become more and more regular, and we've had to learn to deal with them. I will tell you that I spoke last night with President Trump, who was calling to check on the storms, Marco and Laura. He certainly wanted the people of Mississippi to know that he had our back, and he was kind enough to give us the emergency deck that we asked for over the weekend in advance, which is not a given, but I appreciated his willingness to do that. And I think that when you consider what the country's gone through in terms of the devastating impacts of hurricanes, I think there's a lot more awareness by all of our leaders in this country, in the Congress, and certainly President Trump, and certainly the leaders in the state, of the importance of being prepared and having a response mechanism such that we can reach out and help those who need it. Dr. Michelle?
Everything the governor, again, dead on with what he said. I was two things I would like to reiterate with what I believe that has changed since then. And the governor has mentioned this a number of times about a state-managed, locally executed, and federally supported operation. We believe that here, and that is law here in Mississippi. That's the way that we do it. It works very well. So the capacity that we've got at the county level with our emergency managers has changed dramatically. The capabilities. One of the things that everyone that was here during Katrina, I was not, but those that lived through it will tell you that they had to wait long times for stuff to get there. And I will tell you right now that the counties today are very well prepared to at least initially sustain themselves in nearly every aspect of emergency response. And then the state piece as well, equally capabilities there in the way that we coordinate resources and assets. But the next big thing is going to be the mitigation efforts that the state has gone through. If the same storm were to hit Mississippi today that hit in 2005, the effects would be different. It would be less because of the mitigation that's been done. So Mississippi's come a long way. We may have to experience that again. I hope not. But if we do, I believe that we'll be in a much better position to respond should that happen.
Governor, we still have a handful of sheriffs in the state, most notably DeSoto County Sheriff Bill Rasco, who say they refuse to enforce your executive order that includes mask mandates, the social distancing requirements. Is a law enforcement official who refuses to enforce your executive orders violating the law?
Well, I don't think there are very many law enforcement officials in Mississippi that pick and choose which laws they enforce. I haven't spoken to anyone, any of them personally, that have said that. But look, the reality is enforcement of all of these executive orders is exceptionally challenging, and we know that. The best enforcement mechanism we have is for the people of Mississippi to enforce it themselves, understanding that the best way in which for us to slow down the spread of the virus is to wear a mask, is to stay socially distanced, is to avoid social gatherings where possible, and you know, if you do those simple things, we can go a long way towards reducing the amount of spread of the virus. And we, by the way, it's not just us three guys up here saying that. I mean, we've proven it. We've proven it over the last 3 or 4 weeks. You know, if you walk around just about anywhere in our state, what you'll see is significantly higher participation rates in doing those things today compared to 2 months ago, and that's the reason that we're seeing a significant downturn in the total number of cases.
You think part of it is people don't, and again, maybe not everybody went to civics class or knew some of these things, but they sit there and they go, an executive order is a suggestion. A mandate's not a requirement. It's not, to my understanding, an executive order has the effect of law and is backed by state law in the case of these that are issued during.
There's no question that the emergency powers that the legislature, previous legislature and previous governor signed, I believe 40 years ago approximately, it was in the either late 70s or early 80s, gives these executive orders the force of law without question. And so, and by the way, the vast majority of Mississippians are law-abiding citizens, and they want to follow the law. They're like me, they don't want to wear a mask, but most of them are doing so because they believe it's in the best interest of themselves and their fellow Mississippians.
Yes, Governor, there's a picture of you online at a campaign event for Dan Forrest when you were in North Carolina recently. And in the photo, you're not wearing a mask. Did you wear a mask at the event, and did you join the large crowds that were there?
So I'm not wearing a mask now. I believe when we're looking at speaking, I rarely wear a mask. I didn't wear a mask to the funeral of the deputy sheriff from Simpson County. Y'all criticized me pretty significantly for that. The reality is that I was definitely at an event with a good friend of mine, Dan Forrest, who's the Lieutenant Governor of North Carolina, the Republican nominee for governor. It was a campaign event. We believe that political speech is protected. It is not at all unlike the protests that went on in downtown Jackson and other places. And so while I was in North Carolina, I wore a mask about 90%. Look at that. If they did that today, I haven't seen it. But as soon as I get back, I'll take a look at which two flags. With respect to the second question, I'm not at all surprised. That was always a possibility, and quite frankly, I would argue a probability that those who would like to maintain the 1894 flag had the opportunity to gather the signatures to put it on the ballot. And so I'm not at all surprised by that, and I'm not surprised to hear that they have 6,000 volunteers around the state to do that.
Governor, just as a point of clarification, and again, with all due respect to Kobe's question, comparing a political event to protests where the vast majority, if not all, were wearing masks, I'm looking at photographs here, and unless everybody took their masks off at the same time, it didn't look like many people at all were wearing them at that event. I think the two were just very different. I mean, I get what you're saying, but it doesn't seem like it's a very fair comparison.
Oh, I think it's a very fair comparison, and I think that protests are protected, and I have defended the rights of those to protest repeatedly, both when those on the far right were protesting certain orders that I had enacted, as well as when those protests occurred in downtown Jackson at the governor's mansion. There were literally thousands and thousands and thousands of people outside the governor's mansion protesting, and I defend their right to do so. But just because you agree with those who are protesting doesn't mean that there's not public health risk to doing so. There's public health risk to doing large political gatherings, but in this country, and we do still live in America, we protect the right to free speech, and we protect the right to political discourse and political events, quite frankly, and I think it's important that we do so.
I've got a question on a different topic. There have been a rash of prison deaths in the last few weeks. There's concern that some of these could be from COVID, yet we have not been able to get any kind of confirmation on that. Seems like the public's maybe kept in the dark a little bit on that. Can you shed some light on that, either you or Dr. Dobbs? I know at least, and again, I'm not equating the two, but in the 67 deaths that we had today, 7 from Rankin County. Don't know if any of that's tied to anybody over at CMCF, but any clarification or anything that could help on that would be helpful.
In terms of inmates, what I have, the most recent data that I have, and this was as of today, as of Tuesday, August the 25th, which is today, we have had 524 positive cases amongst inmates. We have presumed dead from COVID, 12, which are not all confirmed by autopsies, and we have 1 death that has been confirmed by autopsy. So 12 presumed dead because of COVID, and 1 COVID-19 death that has been confirmed by autopsy is the data that I have. Yes, sir.
Yeah, Governor, going back to that again, the rally we're at. When it comes to that, I wasn't questioning the political speech aspect of it. I was just asking, as a leader of Mississippi, is it important, do you feel like it's important for you to wear a mask in public to show that even you would are not above wearing a mask, and we all need to work together?
Yeah, no, there's no question when I am in public, and admittedly I don't leave the governor's mansion very often right now, other than to go exercise, and when you're out in when you're out in downtown Jackson on the weekend and there's no one around, I don't think wearing a mask is necessary. But there's no doubt that we have recommended and suggested and signed executive orders asking people to wear masks, and the reason we have done so because we believe the science is correct in that if you wear a mask and if you socially distance, it is likely that you can help slow the spread of the virus. And that's what we're trying to do, and in fact, we've proven that. And I appreciate all the Mississippians that have done so much to make that happen, and we're going to continue to work to continue to see declines, because what we're seeing is at the peak of hospitalizations, we had 1,250 people that were either confirmed COVID or suspected COVID, so 1,250. That number has come down closer to 900 today, so we're down almost 25% from the peak. We need to come down another 25 to 50% from where we're at today to get back to numbers more similar to where we were in March and April, and that's certainly something that I'm going to work very hard to do.
Governor, with the Republican National Convention going on this week, and we're seeing a lot of people discuss their impressions of the president, you've talked about having a good relationship with President Trump. What do you think we need to know about the president that maybe we haven't had a chance to see that maybe you would be privy to?
Well, I spoke with him last night and had the opportunity to thank him for his commitment to the people of our state. We've had a lot of disasters occur in Mississippi in the last 8 months. And I can tell you, every single time I have personally asked the president for help for the people of Mississippi, he has stepped up and provided that help. Every single time, and that matters, and it's not just him personally; it's his entire administration. We obviously had Vice President Pence, who I've had the opportunity to work very closely with. Every single time we've asked, they've stepped up and said yes. We've had Administrator Gaynor of FEMA here in Mississippi. We've had, and by the way, congratulations to Chad Wolf. Chad Wolf is someone who's got a lot of family in Mississippi, my constituents, who today the president officially nominated to be the head of the Department of Homeland Security. I'm very proud for him. He spent a good bit of time in his early years in our state, but he's been to Mississippi when we had the the tornadoes on Easter Sunday. He came down to visit. Dr. Burks, the leader of the coronavirus task force, has been in Mississippi to work with us. And so when we talk about the Republican National Convention, I think it's important to note that having relationships with those in charge in Washington is something that's critically important to our state. It's been helpful that when things got really challenging, when we thought we were going to get potentially a level 2 or level 3 hurricane back to back this week, having that initial emergency deck signed and approved gave us a leg up compared to where we might have otherwise been. And so, it's we're going to move into this campaign over the next 70 days, and it's truly a fight for the soul of America and the direction of our country. And I will tell you that, obviously my opinions are very clear, but the one thing I can tell you about the president is every single time he calls, and this is exactly what he said to me last night, tell the people of Mississippi, I've got your back. If the hurricane hits, we'll be there to help. I think that matters. I think that matters a lot, and I sincerely appreciate it. Now, that's not necessarily the narrative you read about when they're writing articles about the president, but that is certainly, that has been my experience, and I appreciate his friendship. Seeing no other questions, thank you all for being here today. We still are in the midst of this fight, and I want to make sure everybody stays focused on winning this battle. Thank you all. Stay safe, and God bless Mississippi.